Welcome to part 2 of safe medication dosage calculation. This part is going to focus on dimensional analysis, which is the easiest way to do medication math, and it's the best way to use as it's going to help you through all 4 blocks. Of course, there's more than one way to do math. Dimensional analysis is just a way that we feel makes it easiest to follow through the rest of your entire program. When we do dimensional analysis, we move left to right. On the furthest left, we start with what we're looking for. What is the problem we're trying to solve? Like how many tablets are we going to be giving per dose? And this is step 1. Now that we know what we need to solve, we put our equal sign and then we start moving right. Step 2, we're going to move directly to the right and put down what we know about what we're trying to solve on top. So if we're trying to find tablets and we know something about tablets, like the dose of a singular tablet, then that's what we put directly across from the equal sign. This creates our numerator, or our top number, and the denominator is the rest of what we know about the tablets. Step 3, we're going to multiply what we have by placing it on top of the next column of numbers. By doing this, we can cancel out our units to leave us with just tablets per dose. Step 4, we will cancel out our units of measurements that are the same. This should leave us with what we're looking for. Our last step, step 5, is to multiply across the numerators to create a new numerator. Then multiply across the denominator to make a new denominator. Then we reduce to get our final answer. This is going to look so much better with real numbers, I promise. All right, so let's do this whole process with a real order. The provider ordered ampicillin 500 milligrams. We have available to us ampicillin in 250 milligram capsules. How many capsules will we administer? Step 1, we need to find what we're trying to solve, which is how many capsules per dose. Step 2, we need to go straight across the equal sign with what we know about capsules. We know that one capsule is 250 milligrams. Step 3 is adding what we have, which is 500 milligrams per dose. In step 4, we're going to cancel out the like units, which would be the milligrams. So all we're left with is capsule on the top and dose on the bottom, which is exactly what we're looking for. In step 5, we do the math and we come out with 2 capsules. Now let's do this process all over again with a different order. The provider ordered Lasix 40 milligrams. We have available to us Lasix in 20 milligram tablets. How many tablets will you administer? Step 1, we find what we're trying to solve, which is how many tablets per dose. Step 2, we need to go straight across the equal sign with what we know about tablets. We know one tablet is 20 milligrams. Step 3 is adding in what we have, which is 40 milligrams per dose. Step 4, we cancel out the like units, which would be the milligrams, so we're left with tablets on the top and dose on the bottom, which is exactly what we're looking for. Step 5, we're going to do the math, and it comes out to 2 tablets per dose. Now let's do the process again, but this time we're going to use a supplied liquid. The provider ordered Demerol 75 milligrams. We have available to us Demerol in 50 milligrams per milliliter. How many milliliters will you administer? Step 1, we find what we're trying to solve, which is how many milliliters per dose. Step 2, we need to go straight across the equal sign with what we know about milliliters. We know 1 milliliter is 50 milligrams. Step 3 is adding in what we have, which is 75 milligrams per dose. Step 4, we cancel out the like units, which would be the milligrams, so we're left with milliliters on top and dose on the bottom, which is exactly what we're looking for. Step 5, we're going to do the math, and we come out with 1.5 milliliters. When we do our dosage calculations, we're not always supplied medications in the same measurement of weight as what is ordered. For example, we have an order that's in grams, but the medication comes from pharmacy as milligrams. In this scenario, we have to convert one or the other to make the units of measurements the same so we can accurately calculate the number of tablets or capsules we are giving. Sometimes we have the right units of measurement for the medications, but the patient's body weight needs to be converted. In this case, we'll have to convert from pounds to kilograms in our equation. Or we can solve for kilograms first and skip that step That part is totally up to you. So let's do this process again, having to change some units of measurement. The provider ordered Flagyl 0.25 grams. We have available to us Flagyl in 125 milligram tablets. How many tablets will you administer? Step 1, we find what we're trying to solve, which is how many tablets per dose. Step 2, we need to go straight across the equal sign with what we know about tablets. We know that one tablet is 125 milligrams. Wait a minute, we just wrote down milligrams, but the next thing we can write down is grams, and we can't do that. The next thing we need to do is follow with what we know about milligrams, and in this case, we know that 1,000 milligrams is 1 gram. Next, we have to put down what we know about grams, which is 0.25 grams is our dose. Now we have the ability to cancel out the grams and the milligrams. So do you see how we couldn't go forward just from milligrams to grams because they're not the same unit of measurement, so we can't cross them out. So step 4, we cancel out the like units, which would now be the milligrams and grams that we can cancel out. So we're left with tablets on the top and dose on the bottom, which is exactly what we're looking for. In step 5, we do the math and we come out with 2 tablets. So for this example, I simplified the slide by writing out the entire equation for you. See if you can follow what I did to solve the problem. Okay, so we have a little longer math problem here because we're adding in a weight-based provider order. To make this a little easier to see everything going on, I color-coded likes with their likes. Our order is to give 25 milligrams per kilogram of Keflex per dose. The child weighs 66 pounds and Keflex is supplied in 125 milligrams per capsule. How many capsules of Keflex will we give per dose? On the left-hand side of the equation, we have number of capsules per dose, as that is what we're looking to solve for. On the right-hand side of the equal sign, we start with what we know about the capsule. We know one capsule is 125 milligrams. Now we need to add in what we know about milligrams, which is 25 milligrams per kilogram from our order. Now we need to figure out what we know about kilograms. If we already had the weight in kilograms, we could put it in now and end the equation, but we know pounds instead, so we have to add that conversion in. So we know that 1 kilogram is 2.2 pounds, and we know that the child weighs 66 pounds. We're going to write dose under that just to end the equation, but you can leave it blank. It's basically acting as a 1, so leaving it blank or writing in dose does not change the equation at all. Lastly, we're going to multiply across the numerator and multiply across the denominator and then solve the math. Okay, let's take our last long problem we just did and make the supplied medication a liquid. Our order is to give 25 milligrams per kilogram of Keflex per dose. The child weighs 66 pounds and the Keflex is supplied in 125 milligrams per 5 milliliters. How many milliliters of Keflex will we give per dose? On the left-hand side of the equation, we have number of milliliters per dose, as that is what we're trying to solve for. On the right-hand side of the equal sign, we start with what we know about milliliters, and we know that 5 milliliters is 125 milligrams. Now we need to add in what we know about milligrams, which is 25 milligrams per kilogram from our order. Now we need to figure out what we know about kilograms. If we already had the weight in kilograms, again, we could put it in there now and end the equation, but we know pounds instead, so we have to add that conversion in. So we know that 1 kilogram is 2.2 pounds, and we know the child weighs 66 pounds. Again, we're going to write a dose underneath that just to end the equation, but again, you can leave it blank. You can write in dose. It doesn't change the equation at all. Then lastly, we're going to cancel out those similar units, and then we're going to multiply across the numerator, multiply across the denominator, and solve the math. And in this situation, we're not getting the number of tablets or capsules, we're actually getting how many mLs we're going to give. All right, now we're going to do our last long problem, and we're going to make this a supplied medication in liquid form and weight-based, needing a conversion. Our order is to give 10 milligrams per kilogram of vancomycin per dose. The patient weighs 176 pounds and vancomycin is supplied in 1 gram per 100 milliliters. How many milliliters of vancomycin will we give per dose? On the left side of the equation, we have number of milliliters per dose, as that is what we're trying to solve for. On the right side of the equal sign, we start with what we know about milliliters, and we know that 100 milliliters is 1 gram. Now we need to add in what we know about grams, which is 1 gram is 1,000 milligrams. Now we need to add in what we know about milligrams, which is 10 milligrams per kilogram. Next, we need to add in what we know about kilograms, which is 1 kilogram is 2.2 pounds. And then lastly, we're going to add in what we know about pounds, which is 176 pounds, which will be over dose or just leave it blank. We're going to cancel out all the like units that are the same, and then we are left with mLs per dose. Lastly, we multiply across the numerator, multiply across the denominator, and then solve our math. And I just want to let you know that if you can figure out an equation this long, you can easily do block 4 math. So that's why we like to say start with dimensional analysis, because if you can figure out this flow, you can use this map through all 4 blocks. And this is the end of part 2 of safe medication dosage calculation. Part 3 of this series is just going to be a lot of examples, but it's not voiced over. They're your practice equations you need to do to prep for class.